Welcome to Philanthropy in Focus, where we shine a light on the people and organizations making a difference in our communities. From executive leaders to frontline team members, each episode offers an inside look at the mission, challenges, and opportunities shaping the nonprofit and healthcare sectors today. As we celebrate Heart Month this February, it's the perfect time to highlight the importance of cardiovascular health and the incredible work being done at the VCU Pauley Heart Center. Whether you're a donor, volunteer, or simply looking to connect with causes that matter, this series is designed to inform and inspire, reflecting Heritage's commitment to helping families align their wealth with purpose and impact. I'm your host, Carrie Miller, Director of Philanthropy at Heritage Wealth Advisors, and today we're honored to be joined by my friend, Dr. Greg Hundley, Director of the VCU Pauley Heart Center.
Well, thank you so much, Carrie. Really appreciate the opportunity to be here and to meet with you and discuss more today.
Well, it's truly a joy to have you here. So, Dr. Hundley, to start, could you share a little about the VCU Pauley Heart Center and the role it plays in the Richmond community and the broader healthcare landscape?
Yeah, absolutely, Carrie. And again, thank you. You know, the Pauley Heart Center at VCU, what does it do? Well, first of all, let's think about cardiovascular disease is the number one killer of individuals, unfortunately, really worldwide. You know, about a third of all of us succumb to cardiovascular disease. So what does a heart center do at an academic medical center? And VCU really being the preeminent academic medical center, not only for Central Virginia, but really in the state. And what a heart center is going to do is coordinate the activities around clinical care, research, education, community engagement, and then finally organizing and monetizing new developments, not necessarily for the purpose of just making money or something like that, but when you can get a new innovation into the marketplace more quickly and it shows benefit, then it can have greater efficacy, again, to combat that 33% mortality related to cardiovascular disease.
And this is all happening like right down the street.
Yeah, absolutely. You know, boy, just a wonderful resource we have in Central Virginia to have a heart center and, you know, all of those that contribute to it in so many different ways, whether it be our administrative teams, our scientists, our clinical physicians, our community members who also donate their time and energies in different ways, sometimes with their presence at an activity, or sometimes with monetary needs, which are becoming increasingly important. Also, our state government and our federal government, who also contribute in important ways to heart health.
Well, thanks for providing that context, and you've built an amazing team over there. Having had the privilege of working alongside you previously for 8 years, I've seen firsthand the impact Pauley has made and your deep commitment. And I can't believe I didn't start it by saying, after all these years of saying it, that it's the top heart center in the state. So I know you've devoted much of your professional career to advancing cardiovascular health. Would you mind sharing what continues to inspire you on a personal level?
Yeah, I think, Carrie, each day, the opportunity to help other individuals. And we have many different opportunities to do that. If we look in our communities in and around Richmond, Petersburg, Hopewell, and we start thinking about, gosh, in some of those communities, over half the people have risk factors for cardiovascular disease, like high blood pressure. In some of the communities, the average lifespan of an individual is 63 to 68 years. And you say, well, what is the cause of that demise? It's not some of the things that stereotypically we might think of, drug use or what have you. It's cardiovascular disease. It's heart attack. It's stroke. It's the development of heart failure. And so when you say what inspires you, certainly providing excellent care when someone is undergoing a heart attack. In any of these communities, regardless of which health system that a patient seeks care, within 90 minutes of identifying a chest pain syndrome indicative of a heart attack, you can get into a catheterization lab. But another thought and so inspiration on maintaining that excellence of care and response is a motivating factor. But also importantly, it's thinking about how do we prevent the first heart attack? How do we prevent the stroke? And I think where the Heart Center, through community engagement, education, and research, is really making an emphasis is where do we start to learn about heart disease? Elementary school, high school, college. I think back to my years. I'm in my early 60s, and I think when I was in high school, I didn't know what my blood pressure was. But could we start to think about educating younger individuals about the importance of high blood pressure, the importance of diabetes, what that can mean consequently down the road? What are, we hear about the good cholesterol, the bad cholesterol. What if we started to learn a little bit more about that at a younger age? And we start to think about our educational system. And again, I'm falling back on what took place in the 1960s, 70s, and 80s. We were learning to add and subtract. How many apples in one basket? 3 apples in this basket, 2 apples, and then we pour them all together and we get 5 apples. Well, what if we started to think about items like blood pressure when we were learning math or learning science? My blood pressure is 150 over 70, but if I took a medicine and it went down to 120 systolic, what's the difference? 150 minus 120 is 30. We can start to integrate some of those concepts so that at least we raise awareness. And boy, I'll tell you, having a 4th grader in the household reminding a mom or a dad or a grandmom or a granddad about that blood pressure and that blood pressure medicine, that could be a real inspiration, perhaps.
Well, I've seen some of these things seem like just really idealistic and stuff like that. But I've always admired that you're not scared to start chipping away at it. And with blood pressure and actually working with kids to do that on a school board basis and things. So I'm excited that you don't turn away from some of these things, even when I'm like, well, that sounds really inspirational, but pretty daunting. So I know that there's other moments, and I don't know if you want to talk about Teach BP, but is there a program, milestone, or personal story from your time at Pauley that you feel especially proud to highlight?
I think there are specific programs, but there are also general sort of concepts and where the Heart Center is moving. And I think I'd start first with generally. First was, our Heart Center has been, and even VCU as a whole and formerly MCV, it's really been the flagship for the state for procedural care. And so I think we've been very proud to amplify that in the realm of cardiovascular disease. Importantly, Dr. Vig Kasarajan, who runs the Department of Surgery with the enormous expertise in surgical procedures, bypass surgery, valvular-related surgery, but also in the realm of heart transplantation. We're arguably one of the leaders of the total artificial heart, and continuing on with that particular science, in heart transplantation. A lot of the rudiments and its foundation actually happened right here in Richmond, downtown here at our VCU Health campus. And so, in the world of electrophysiology and working Dr. Ken Ellenbogen, who many are familiar with in this community, and thinking about new ways to manage a very common arrhythmia. About 10% of individuals worldwide, but also here locally in the Richmond area, develop this rhythm called atrial fibrillation. Oh my goodness, is it? It's not one of those rhythms necessarily that leads to an instantaneous mortality, but boy, does it create morbidity. It reduces really the efficiency of the heart and its pumping mechanism, and so you have about a third less energy to do activities of daily living. And Ken, Dr. Ellenbogen, and his initiatives have been to rid that through procedural cares, and you hear the term ablations, but also thinking about ways. One of the difficulties with atrial fibrillation is clots can form in the heart, and one can experience when those clots break off a stroke. And Ken and his team, now also with Jay Conneru and others, have been working to put in devices where not necessarily would we have to always take a blood thinner to prevent that stroke. And that can be very important for individuals with jobs and things like that, where they bump into things and have a risk of bleeding. So those procedural clinical innovations, and I would say another one more on the diagnostic side is imaging. Some of the advancements in imaging downtown at our facility are actually recognized almost worldwide, particularly in the areas of this magnetic resonance imaging, and now more recently some advances with some of the ultrasound imaging. We are really imperative for the community in not only performing those procedures at our downtown location, but also when you can't get there and you're in a rural community hospital, helping those facilities implement those same standards. And so building out teams of individuals, not only that on maybe the physician side that can help interpret those images, but working with our community colleges to develop training programs to amplify the workforce for technologists and technicians that can go to high school. Students can go to high school, graduate, do 2 years of community college, and then walk into a job operating ultrasound, magnetic resonance, computed tomography, CT scans at a job of $85,000 a year. Can you imagine? And nationally, we have giant shortages of these individuals. So it's sort of job creation really on the clinical side. So, you're asking about things that you're proud of. It's I think sort of building out all of those programs to deliver care. And then we can talk a little bit more about some of the initiatives in prevention. I know you mentioned one about blood pressure, but there's several others.
Well, I mean, and I knew it would be really hard for you to pick just one because you're a busy guy. So we really appreciate you being here. And again, I'm just amazed at all you can continue to move forward. So for those who are feeling inspired by the Pauley Heart Center's mission, especially during Heart Month, what are some meaningful ways people can get involved through giving, attending events, or participating in community programs?
I think there are 3 ways. Great question, Carrie. One is, regardless of where you are in society and what your profession may be or what your interests may be, sharing some of that with us is really helpful. We have programs called community advisory boards. And what those groups do, monthly, we talk about a topic. Maybe it's, how do we get an appointment? How do we address this concern in our community? We have a shortage of maybe getting the right fruits and vegetables, which are part of life's essential 8, right? The correct diet. How do we work with individuals at the health system? And we have those, to achieve those ends for the community. And we have community advisory boards. And under the help with Deborah Pora and several others, Arnethia Sutton, participating in these community advisory boards and sharing how we can optimally work together, community members and team members at the Heart Center, to improve health in the community. So that's number one. Number two, there are direct events. Let's say we come up with a particular solution. We want to check cholesterols in the community, or at the fairgrounds, or whatever that may be. Boy, could we use help. Volunteering time to come and work through activities would just be really helpful. And Dr. Amy Ladd, who really is our organizational expert at the Heart Center, can help channel and match your interests for things you might like to participate in with the different activities that are constantly ongoing as we interact with the community. And then I think third would be financial resources. One of the initiatives that, as we're all problem solvers, we're great problem solvers. We don't just want to be problem identifiers. We want to be problem solvers. Mm-hmm. And so that problem solution involves research. Now, the big research dollars, where do they come from? They come from industry, some of these big companies. They come from our federal government. We hear about the NIH, other aspects of our federal government. Believe it or not, our departments of defense have a health research organization. The Congress has one called PCORI, the Patient Center Oriented Research Initiative. So these are the American Heart Association. Others have big grants. But to get those groups to do the big grant thing, it's kind of like, for your listeners, Shark Tank. If you've ever seen Shark Tank on television, the sharks are up there and someone's pitching their idea. And the sharks, how many sales do you have? How many this? How many that? The sharks want to put money in when they know that they're going to get an answer and it's going to work. Well, that's the same thing with research, right? These big organizations, whether it's a corporate entity, the federal government, a society like the American Heart Association, they want to put money into something that they know is going to work. Well, wait. We've got to have an initiation of an idea, and that's called a pilot grant. And so that's going to be an investigator. Maybe a community member has a great idea. Someone in the Heart Center, I've got an idea, but I've got to show the fundamentals that it can actually work in the first few patients, or maybe in an animal model, or maybe in the community, in society. And so we need individuals that are willing to provide financial resources for pilot grants. And that is a key thing. Think about all the folks that Steve Jobs, you can read about how Apple got started. Remember, in a garage and cobbling together, and look at what that is today. It was getting those resources initially for pilot initiatives that we need help. So 3 ways: community advisory boards. We definitely need input there. And I think Deborah Pora, number 2, participating in the activities when they get organized, and with Dr. Amy Ladd. And then now our pilot programs, and that is run by Megan Blackwell. And so any ways that we can get financial resources to support that would be super helpful.
Okay, so this is my favorite question to ask everybody who comes in. What's one question you wish donors or supporters would ask you?
How can we get involved? How can we, with cardiovascular disease touching so many lives in so many ways, again, coming back to a third. So if we're sitting in a room of, 12 people, we've got 4 that are going to have a heart experience. And so it's prevalent through families. It's prevalent, we see every day almost in the news. Think about the COVID pandemic, and one of the big fears was getting myocarditis and inflammation of the heart. And so it's how can I get involved? And so as a community member, and I'm more than happy to help match your interests with what is going on across the many different domains that we have discussed in the preceding 20 minutes. And I think we need help on so many fronts today to combat this disease process that love having that question. And then what I like doing is also listening to you as a constituent or a person in the community, because your ideas melded with some of our ideas, that's where we get the great solutions, because they're meaningful to the community. So love those opportunities whenever they arise, and welcome the chance if you identify groups of individuals and would like to discuss more because maybe you know of a church group or someone else that is very interested in an initiative. I'm happy to come and we share back and forth in ideas like that.
Well, thank you, Dr. Hundley. And after years of meeting so many of the patients, it was a surprise when I had to be a patient myself with the Pauley Heart Center. So I know that you treat everybody absolutely the best. And it is true that looking around the room, there's always going to be someone in there who has been impacted in some way. And hopefully there's a positive side of the outcome there. So thank you for joining us and for sharing more about the VCU Pauley Heart Center and the number one killer in the world today, heart disease. So I'm so appreciative that you were here. And if anyone who wants to learn more or get involved, you can reach out to me. And we'll also include links in the resources in the show notes. And I'm Carrie Miller, and this has been Philanthropy in Focus. Thanks for being here, Dr. Hundley.
Thank you, Carrie. Really appreciate the opportunity and the Heritage Foundation and all the great work you're doing for our community.